I believe the release yesterday said that there was a fresh outbreak at Frankston Hospital. Do you have further information on that?
I may have some further information on that. Certainly, we're aware of cases linked to Frankston Hospital. Again, as we've said, for all healthcare worker infections, it's not always clear how they've been acquired, but it's a stress, obviously, for those who are involved, and there's furloughing or quarantine for their close contacts that are obviously often other healthcare workers as well as their families. I'm not sure if I've got specific numbers for today. Minister, do you have anything? We can come back to you.
Can I pick up on one of Premier Andrews?
Oh, we're back.
No. To you. No. Just about around compliance. We know you would know more than any of us around here that punitive measures are generally not conducive to public health messaging. Can you walk us through what your advice was to the government on not only the hefty fines, but a couple of weeks ago, subsequent, infringements now cost about $5,000?
I didn't really go to Cabinet on issues of compliance. I think it's really for the relevant ministers and for Cabinet in general to make determinations around the nitty-gritty of how compliance is best met. My advice was really on the public health principles, that we needed to have a very significant reduction in the interaction of people. How you practically bring that into being are matters of communications and engagement, compliance and enforcement that are for the relevant ministers and secretaries of those departments, really.
As a public health expert, though, what do you think about the enforcements that are in place, the hefty fines, and also the shaming? Like, every day from Victoria Police we get a few lists of what some people were doing, how they were breaking curfew. What do you think about that approach that we have to?
Look, I think we need a mix, obviously. I would always, as a public health physician, say that we need to put awareness raising and communication engagement at the heart of our approach, and I think it's worked. But there will always be a need for compliance and enforcement for people who are willfully flouting those rules. I don't think police intend to shame anyone in bringing to bear and illustrating those instances of non-compliance. I think they are shot across the bow, if you like, for anyone else who's thinking of also being willfully ignorant of those rules, because people continue to do that, and so I think it does need to be called out when those instances of non-compliance do occur. I think it's overwhelmingly the case that people are doing the right thing. Speaking to the flu season, if you look at April to August, we've had a 300-fold reduction in our flu cases for that season. Don't take it from the beginning of the year when restrictions weren't in place, but for April to August in Australia, 300-fold reduction in flu transmission is extraordinary. It's never happened in the world. At the beginning of the year, we were getting the Northern Hemisphere cases. We still had people travelling into Australia, but with the end of international travel, effectively, and all of the measures that we've had in place from March onwards, that's shown that you can stop a really infectious virus from transmitting in the community. And so these measures that we've got in place and all of the awareness raising that we've got around that are doing the same thing for coronavirus. But it's actually more infectious than flu. It's clearly more deadly, 10 or more times more deadly than flu. But we've saved hundreds of lives from flu this season because of the actions that we've taken for coronavirus. So it's really important that we've got both the rules, but also, real positive encouragement for people to do the right thing.